Namaste, hello, welcome everyone to the second podcast of On Course from Ordinary to Legendary with Ami Jain. Today I have a very special guest with me, Dr. Sameer Paranjpe. He is an Ayurvedic doctor by profession. Namaste, Sameer, welcome to the show.
Namaste.
And
Namaste.
there are lots of interesting things that we were talking about yesterday, but I think I would really like to hear it from you as to your background, your family, and what is it that you're doing.
Namaste.
Namaste.
I am from a village from very humble background. I'm practicing Ayurveda. I have been practicing Ayurveda since 12 years in Konkan, in the Ratnagiri district in Taluka Dapoli. It's a very small village where I started my Ayurveda practice, where nobody was practicing Ayurveda. And in the Taluka place, where everybody was telling me that who will come to you? Every practitioner is using allopathy, and patients are also taking allopathy treatment. So you are the first one who are starting your Ayurvedic clinic here. So nobody will come to you because everybody wants injection only and the fast treatment. So actually, when I took that decision, that was a risky one. And there were some examples where few doctors started Ayurvedic practice, and after a few months or after a couple of years, they switch to allopathic practice. So at that time, it was a risky decision to continue my Ayurvedic practice in a village. But somehow, after 3 years of continuous practice and with patience, I could stand. And now, after 12 years, now it's like boom. So now I will not see back. And now patients from different taluka places, from districts, and now from patients from Mumbai, Pune, they are also coming to seek Ayurvedic treatment. And I'm very much happy that my MD guide, my guru, told me, he suggested me not to do practice in city place. Actually, I completed my MD from Pune, and my guide said, you should go to your village and you prove yourself in a village where nobody is taking Ayurveda. So once you prove yourself in village, then you can go anywhere. In any country, you can do well. So I started my practice. This is my journey. And now I'm doing well. Patients are getting results. And I'm now working on a special cause. And I have taken a subject where it is a neglected subject, actually, at least in our region, where people, mainly ladies, don't talk about menopause. And for last 10 years, 12 years, I have been doing the same. And there is a story of my mother on which I am going to write book in English and in Marathi also.
Okay.
But that story was actually, my mother's story is my inspiration to work on this special cause on menopause, because there are so many complaints for which there is no treatment in allopathy. Only there is one treatment available, that is hormone replacement therapy, means estrogen pills that patients should have to take. And there are so many side effects of estrogen in heavy doses. There are chances of breast cancer also. So doctors also generally don't prescribe heavy doses of estrogen for menopausal ladies because they know its side effects. And that symptoms don't get attention, because every time people say this symptom is due to menopause, leave it aside. This symptom is related to menopause, don't treat it. So there are so many symptoms, more than 20 symptoms, and lady don't get proper treatment for those symptoms, and only with the calcium supplement and vitamin supplement, that is not going to be correct. So for that, uh, proper treatment, proper guideline is needed, and I have designed that kind of program for premenopausal and menopausal and postmenopausal ladies, for whom we are treating with Ayurvedic treatment. It contains Panchakarma, Shirodhara, Sarvanga Abhyangam, whole body massage. A lot of dryness on the skin and in intestine causes so many complaints. Osteoporosis is also the important thing that happens in such ladies. And just few, not few, a week back, I saw a patient. She got fractured just with a simple sheer fall in her home, and her femur got fractured due to osteoporosis, severe osteoporosis. That kind of severity of osteoporosis is there, and people are not aware about that osteoporosis, calcium deficiency, and so many things are there. So I'm working on that.
Yes. So you have raised a very important point, because I think in India, first of all, this subject is almost taboo. Nobody wants to talk about it. Everybody knows about it, but nobody wants to talk about it. Secondly, we have malnutrition anyway in our country in a very big way. Right from childhood, we don't get the proper nutrition that everyone should get. Secondly, yes, the problem that ladies face, I think it's neglected, because there is lack of awareness, perhaps. There is lack of awareness, and this is not restricted to villages. Trust me, it is in cities as well, because I mean, I can speak for my mother. She also underwent breast cancer 2 years ago, and it was a harrowing time. A lot of these things, as you are saying, can perhaps, the number of breast cancer cases are just rising exponentially, I think. And if there is this kind of awareness which is created, and a holistic treatment which can be done at home, doing basic things, eating right food. See, you can't change the environment, meaning the climate and the air pollution and whatever is there. But the least we can do is be aware of what each one's body we can do. Nobody knows about osteoporosis. Nobody knows about, as you were saying, Abhyanga, what is to be done. So I think it's a great subject and great thing that you're doing. But how exactly do you plan to take this forward? I mean, I know you are right now doing it perhaps in your village. How do you want to expand this?
First of all, I want to create awareness among ladies. So I am in contact with so many teachers, school teachers. I want to educate first school teachers in various villages and various places, where if they get first awareness and if they get educated, school teachers can educate in a very nice way to their students' parents. So awareness, there is a nice way to propagate this knowledge through school teachers. And there are so many patients coming to me. They are school teachers, and somehow, someday, they will also land in a premenopause and menopausal phase. So I am educating them to give that kind of knowledge to their students' parents in a parent meeting. That teachers will educate them, and on various platforms, I am giving this kind of speeches in our region. And now this is a nice platform where I can share my thoughts. And in Marathi, I have created a YouTube channel where I have uploaded more than 6 episodes on menopause, where I have shared my mother's story also. And my mother's story means it's only a kind of pratinidhi. It's a symbol of all the ladies who are landing in the pre-menopausal or menopausal phase. So she's the symbolic one. So,
but she is your source of inspiration. And I am really very happy you're taking up this topic, because it affects all of us. And it is not
Yes.
just about making 50% of the population on this earth aware of this problem. I think even the men should know what is it that women are
Great.
going through, because this is not something which we are creating. This is how nature is. And this is a
Yes.
biological progression for any woman. And I think men also need to be aware, because I think women need that kind of support, the emotional support,
Yes.
moral support,
Perfect.
physically,
Perfect.
when you're going through this, because it is a very difficult time. And I don't think
Yes.
people understand,
Yeah, there are
which
so
is
many
sad.
points that I have, that there are so many points that I have covered in my book and in my videos also.
Right.
What is the responsibility of son? What is the responsibility of teenage daughter? What is the responsibility of husband?
Correct.
And how other family members should understand her. Every time only medicaments will not help her,
Right.
but pampering, good kind words, feeling of gratitude, all will help to her. Every time it is not the medicine which will help her, but there are so many things that we can just help by doing that daily chores.
Correct.
There are some duties of husband.
Correct.
Husband should do some things. Teenage daughter, teenage son, he should contribute in her daily routine, daily chores, because everybody is going outside home and she remains at home, so nobody cares. And I'm not telling this thing about other people, but what the wrong things we have done with our mother, that I understand, because nobody understand what kind of pain she feels while doing all that homework and home stuff, that daily chores. And uh, if we make aware about those pains to her husband, her son, daughter, then she will get some kind of relief from her daily routine, and she can give some time for herself.
Correct.
To meditate, to relax, and not only with medicines. At least it is the duty of son or daughter, sometimes husband, to apply oil. Every time it is not needed to go to spa or any panchakarma center or any doctor to apply oil. No,
Right.
it is a duty of daughter or son to apply oil. Sometimes husband also may apply oil, but a simple head massage or foot massage, because her back or muscles, they they are painful while doing all the household work. She just cry, weep, and we label it is the symptom of menopause. But there are so many pain, muscle fatigue, and nobody understand this is the overwork. It's the effect of muscle fatigue. So we should understand her pain, and
Yes.
applying oil is only one thing. Giving medicine, prescribing medicine, that is our duty, doctor's duty. But the things that other family members can contribute, that I am going to give the knowledge to teachers or in a parent meeting, or the ladies or the other people who are attending my program.
Yes.
I concentrate on that topic other than medicine. Only prescribing medicine is not sufficient to ladies.
So it is a
There
holistic
are so many.
solution you are offering, or you're suggesting, because I think everything works together. Nothing
Yes.
works just by itself. And I think more and more
Yes.
people need to understand and appreciate this, rather than
Yes.
taking. I think especially our mother's generation, all our mothers, they are, I think, the most selfless people or human beings that we can ever come across. Never asking or demanding. Demanding is a very strong word. They have never asked for anything for
Yeah.
themselves. And I think it is the
Yes.
least we can do for them. The least we can do is that in
Yes.
this time, or right from when you're saying, I think it's a very good thing that you're saying you create this awareness from the school level itself, so that both boys and girls, as they're growing up, they're aware of this problem.
Perfect.
This is not a taboo subject. Nobody is made fun of. And you're a little more appreciative of what is a woman going through? See,
Yes.
everybody has their own sets of problems.
She gets palpitation, she
Correct.
gets anxiety due to
Yes.
stress. So many symptoms get exaggerated.
Correct.
Sometimes her sugar level gets shooted. Sometimes she get TSH level high, hypothyroidism. Sometimes swelling. Sometimes headache, night sweats. Sometimes hot flushes, and
Yes.
all those symptoms just she neglects. Sometimes lady who is educated, she understand all those symptoms are due to menopause. But lady who don't know anything, who is not educated, she feels this is a black magic. Somebody is doing black magic on me, and she get frightened, and somebody take its advantage. And this type of cases happens in villages. So I educate them.
This
This is not a,
awareness, this is not that. And I think it is very, very essential. Very essential.
this is not a black magic. One lady came to me and she said, I get electric shock. Whenever I touch on floor, I get a shock. Anywhere I touch, I get a shock. So other family members says, I think she's psychic because we are not getting this kind of electric current. So I asked, is there any earthing problem? They said, no, we are not experiencing the same. So that lady went to the black magic person. He took thousands of rupees for to treat that, and she spent a lot of money. And just by prescribing few Ayurvedic drugs and by proper counseling, within 2 weeks, all that symptoms just vanish, disappear. But it's not a black magic, but there are so many symptoms. Hot flushes. Sometimes lady feels somebody is just doing some black magic on me. And this kind of thing happens in the village at least, not in the city. That I don't know what kind of mindset in cities people have. But I want to make aware at least from villages. And whenever I will get a good platform, I will definitely educate ladies who are living in metropolitan cities, because they might be having some different problems. Right now, I am concentrating on ladies who are living in villages who are not educated.
Correct.
But educated ladies also need some more.
No, you're very right, because I think metropolitan cities, there are different kind of issues. There are a lot of ladies are now working. There is a lot of stress anyway in the offices or wherever they are, the corporate world or even otherwise. At home also, I think cities means stressful environment. You have to perform. You have to always perform. Wherever you are, at home, outside. If you have a good supportive family, well and good. But not everybody is lucky in that sense. I feel sometimes even when people know, but they ignore. They don't think, it's okay, it's only 4-5 days in a month, it's okay, she'll be fine.
Symptoms get more exaggerated and a lady feels bad.
Yes. So
actually, there are some ladies who are working in bank or in offices.
Correct.
And at the age of 45, she feels, now I can't continue this job. That kind of patients are treated, where at the age of 45, she says, I don't want to continue. Now, in this stressful condition, if she get proper guidance, proper medication, proper changes in daily routine, then that lady can continue her job with a healthy and happy life. And I have experience of now 12 years. The ladies who were consulted 12 years back, still now they are going to complete their job tenure. And now in the next year, that lady will retire from her job. But she could complete her all tenure. And that kind of experiences we have now. So I want to write book on that. So I'm writing.
So I think what you're saying makes a lot of sense, because I feel so there was often this confusion for a lot of women that I have spoken to, that when you're in your 40s, so maybe this, what you're saying, is one of the reasons, because we used to think it is midlife crisis. What is generally spoken of as midlife crisis, we always attribute it perhaps to that now you don't know what to do suddenly. But maybe what you're saying makes sense to me now when I'm thinking about it, that maybe it is related or linked to all of this, the changes that are happening in the body. So I think what you're doing is absolutely wonderful. And trust me, it is not just religious. They first definitely need, but a lot of women in the cities are also suffering from all kinds of problems, whether related to menopause or even otherwise, just to the menstrual cycle. That in itself is a big problem. And yes, if treated well, I think it would be a great opportunity to lower the rates of breast cancer. That I think is the worst that can happen.
Yes.
To people, to
breast cancer, diabetes, hypothyroidism,
yes.
So many clinical
so
conditions.
many things, clinical conditions.
Yes. If you address stress properly, if you can manage stress, then you can treat all those conditions. And in this period of menopause, this stress level, cortisol level, stress hormone level increases, and lady get hyperglycemia or hypothyroidism. And that kind of patients are coming to me, and whatever medicine she is taking for thyroid or diabetes, sometimes the dosage of her diabetic drugs, anti-diabetic drugs or thyroid doses also we reduce after doing our treatment. I don't treat their diabetes or thyroid. I treat their cause. And menopause is the cause. Stress is the cause. Low estrogen level is the cause. So when I treat all those conditions, underlying conditions, then automatically it shows its effect on her thyroid level, TSH level, on her glycemic index, sugar level. So it's nice.
One thing I want to ask you is generally, at least I'm talking about the city. There is, some of us have this issue about approaching Ayurvedic doctors because of the lead content in the medicines that are given, because that has its own repercussions and ill effects on health. How does one make sure that the medicines, the Ayurvedic medicines that are being given to us, are indeed in the natural form that they should be and are not adulterated?
In this regard, I will say, if you see a good Ayurvedic Vaidya, reliable Ayurvedic doctor, who has written name Vaidya before his name, not doctor.
Okay.
Yes, Vaidya, with the proper degree, registration and all. You just first check who is that fellow. If you go in any hut and at any roadside place, there are so many bad things happening in the society, where first you should check who is that person, what is his degree, is he reliable. So you can connect to a reliable person who is having Ayurveda degree proper, and then you can contact him. And otherwise, to guide him, I'm there.
Yes, you're always there.
Yes.
Absolutely, you are.
Because few years back,
yes,
I was in the moment to find out quackery. There are some quackers, quack doctors practicing in villages, in different areas, where people don't know now who is that person, is it reliable or not. So with the help of medical officer, we found out, and we took action on them. Do you have degree? Do you have certificate? And why are you wandering here and there in places where people don't know anything and they are not educated? So their people went somewhere.
But I personally feel that maybe it is more so in villages, but we are in the cities also not free from this. So where there is this general perception that there is a lot of lead content in the Ayurvedic medicines, or that Ayurvedic medicines are not always safe to have. This perception, according to me, also needs to be changed. So we sometimes even wonder when there are big brands in the market, big corporates. I'm not trying to demean anybody. Let's say, for example, Patanjali or Himalaya or all these people who are also bringing their Ayurvedic medicines in the market. we take it because that we trust that at least these corporates will not do it. But somewhere at the back of your mind, there is still this question that is it whatever we are consuming, is it all right? How does one,
There is a
satisfy?
there is a proper process on the medicines with the help of herbs. Of course, there are metals we are using in our treatment,
Correct.
but there is a proper procedure on the metals. I use Hirak, that is diamond, or Suvarna, that is gold, or Rajat, that is silver, and so many metals that I am using since 12 years by a proper trituration procedure. There are that complex procedures are there, treatments on that metals, and there are some parameters on which if that medicine stand proved, then we use that medicine, otherwise don't. And there are some reliable companies and some manufacturers that medicines are costly, so we don't see their cost, but we see its effect and its purity. First we check that, and for that we should not find out a shortcut for that. This doctor is cheap, so we should go to him. No, though he is charging a lot of money, but if he is giving pure medicine,
it's
then
worth it.
People should, yes, worth it. So we should provide value to patient first, and patient safety is also important. So whenever possible, I check patients' LFT, kidney function test before and after the treatment to just see this for last 4 months, for last 6 months, for last 2 years, patient have been taking the treatment, but his LFT and kidney function test reports are normal. There is no any kind of hazard to those organs. This kind of step is also necessary because there are so many entities in the market. Sometimes they defame you after watching your name and fame. So I keep all the records with me, with all the reports, so that nobody can blame. And that kind of guidance I am getting from my seniors, from my guru, from my teachers, because they are also stalwart in all those matters. So whatever instruction they give, that I follow, and I am practicing here.
Great. So what do you now want to do? Yes, this is a cause which I think you really need to pursue, and I think this is your passion. I believe I won't be wrong in saying this is your passion, that this is how you want to help the women or half the population of this planet. Hopefully, a lot of people, all of us will go through this at some point or the other in our lifetime. But what else is it
I am on a mission.
do?
Yes, I am on a mission to help 10 million ladies, middle-aged ladies, above 40.
Correct.
In any way, through various platforms, with one-on-one call, with live consultation, by any means, through book. But I want to reach 10 million ladies. At least that much part I can just contribute to the society, and rest of the thing will be taken care of by God.
Yes,
and,
certainly.
Yes, and I have started movement, and I have started addressing my students and doctors who are now practicing at various places, so that all the doctors, at least who are my students, they will join this movement, and they will treat, they will educate, they will make awareness in the society, so that then this number can be achieved easily. So many doctors are now joining me in this movement, and let us see in the future. I'm looking forward for great results.
Now, I am sure you will succeed. You are already on your path to success. And I think all of us should be very thankful to you and all the other doctors who are going to help us. So, Dr. Sameer, thank you. It was a pleasure talking to you today. And I hope
Me
that
too.
we can
Thank you.
continue. I hope we can continue this journey of getting more and more information from you, this giving information to the public at large. And I wish you all success in your journey. Thank you so much.
Thank you. Thank you.
Thank you. Thank you.
Have a good day.
You too. Thank you.